AAA stands for Abdominal Aortic Aneurysm, and they can occur from the chest area all the way down to the abdominal area, and actually also in the arteries that go to your legs. An aneurysm is merely a dilation or a growth within the artery beyond its normal size. It's almost like a balloon. And unfortunately, when you have a balloon, sometimes it might pop, and that's what we try to prevent. Unfortunately, when it is recognizable, it's too late.
Right.
Certainly, you can have symptoms as it grows. It may cause some abdominal pain, some flank pain, and that would prompt your visit to our emergency room and then subsequently an evaluation. But for the most part, they're asymptomatic, and so certain risk factors will put you at either a screening process or oftentimes they're found incidentally, which will then prompt a further workup. Smoking first and foremost, hypertension, cholesterol, familial disease are really the main risk factors for development of these abdominal aneurysms. If it's asymptomatic and they come in to my clinic, we'll often get an ultrasound, or they'll come in with a CT scan. And based on the size of the aneurysm, that would then warrant an intervention. And so when is that cutoff? And based on aneurysms, it's the size cutoff. For males, it's 5.5 centimeters, and for females, it's 5 centimeters. Just to give you a frame of reference, the average diameter of the aorta is 1 to 2 centimeters. And so as it grows and it reaches this criteria, this threshold, then the benefit of surgery would outweigh the risk. And so this is in the asymptomatic or the outpatient setting. If they're symptomatic, and let's say they come in having flank pain, we find evidence of an aneurysm, and we see that there's something we don't like on the CT scan, whether there's some inflammation around the aorta or around the vessels, that would then warrant a more urgent intervention, even if they don't meet the size criteria. It's a routine screening that then, as they cross the threshold, would require an intervention. And so there are certain criteria. If you have an aneurysm between 3 centimeters and 3.9 centimeters, you get an ultrasound in 3 years. Between 4 or 5, 1 year. Greater than between 5 and 5.5 centimeters, it's 6 months. So we'd get repeat ultrasounds or screening imaging that would then warrant an intervention if they meet that criteria.